Today we're talking about vitamin D. We hear all the time we should stay out of the sun because it can damage our skin and cause skin cancer. However, a new study suggests that sun exposure may actually be good for us and that the benefits of a little sunlight may outweigh the cancer risks. Surprisingly, sunlight may be the best source of vitamin D. So, how much sun should we get? And who should or shouldn't stay out of the sun? Here to tell us about this new finding is Dr. Doris, Clinical Assistant Professor of Dermatology at New York University. Welcome, Doctor.
Thank you for having me.
Great. You know, I remember in medical school we heard of vitamin D as the sunshine vitamin, and now we're hearing that vitamin D and the sunlight is important in terms of heart disease, protecting us from some cancers. But yet, what's a patient to do? We're all advised to use sunscreens and avoid the sun.
I know.
Can you give us a little background?
Yeah, it is complicated, but I would say that vitamin D is really important, and I'm so impressed with all the data that's coming out about how healthy vitamin D is for you. However, vitamin D can be from more than one source, and I would argue that the sun is the last place that you should count on for getting your vitamin D. I don't think it's reliable, and every day in my office I see the havoc that the sun can wreak on the skin, and I think that you're better off getting vitamin D from a supplement, from a vitamin, from fortified foods. In this country, everything is fortified, and it's very hard not to get vitamin D from a food source. And for all intents and purposes, the vitamin D that you eat is the same as the vitamin D that you get from the sun. So I would say take it from a supplement. Don't count on the sun for your vitamin D.
But I know, Dr. Day, that we've looked at studies of middle-aged and older people, and up to a third to a half of them don't have enough vitamin D in their blood. So obviously people aren't getting the vitamin D that they need. And I think the question I would ask to you is, what is the role of vitamin D and the sun? How does that work? And how is the sun different than taking a supplement?
Well, I think that if you look at people who do not get out and don't get sun exposure, they actually aren't probably getting fortified foods and supplements, and that's a matter of education. But what happens is when a study comes out and says, oh, the sun is the best place to get vitamin D, it becomes an excuse for people to go to tanning salons, for people to spend excess time in the sun and do more damage. So it's really a matter of balance. If you get normal sun exposure over time, if you exercise, if you go outdoors, even if you use sunscreen, you're still going to make vitamin D, and you may still need supplements to help get enough vitamin D. However, the sun does two things. With ultraviolet exposure on the skin, that helps stimulate the vitamin D production, but there's also steps that take place in the liver and the kidneys that helps activate that vitamin D. So it's a three-step process. The other component of vitamin D is that over time, the more sun damage you have, the question in my mind is how efficient is your skin at making vitamin D? So there are a lot of studies that need to be done that compare vitamin D production from sun exposure, vitamin D production from supplements, and vitamin D production in skin that's very highly sun damaged.
Right, and we didn't talk about the fact that people who live in North America, for example, the more northern climates, there's the cloud cover, all those things can impact your ability to get vitamin D, and certainly in the winter months, that's another factor. What about sunscreens? People listening are wondering, do sunscreens completely block the production of the vitamin D on their skin?
They don't completely block it, but they do reduce it because it is protecting against UVB, and that's its job. That's what we use sunscreen for, to protect against UVA and UVB. And by protecting against it, you are also reducing. Now, sunscreens are not 100% effective, and people don't apply enough, they don't apply it properly, and they don't reapply it regularly. So chances are you're still making vitamin D in spite of using sunscreen, and you should continue to use sunscreen because the benefits of sun protection on the skin, I think, outweigh the risks of vitamin D deficiency because we do have other sources of vitamin D in this country that are incredibly effective, and I think would be a much smarter way to go than to count on the sun to make your vitamin D.
Let's talk about some of those sources of vitamin D, because people are listening. They want to know, what are those sources? Are there food sources? Let's forget supplements for a minute. What about foods that
Well, really cod liver oil and fortified milk, but really food sources for vitamin D. The problem is that they're not that common. We really count on highly fortified foods and supplements for vitamin D, and that's part of the problem. Is that that's where the education comes in. Is that you have to understand vitamin D is fat soluble, which means your body has potential to store some of it. So, and also when you take vitamin D, you should take it with a meal that contains some fat. Women should be taking vitamin D with calcium because they do have a synergistic effect in absorption. So women who are taking calcium supplements, chances are their calcium supplements also have vitamin D. I recommend for my patients that they take 1,000 units of vitamin D per day. And if you count on vitamin D production in the skin, after a certain level, your skin will actually break down the vitamin D to help prevent toxicity. So it isn't that if you get more and more sun exposure, you're just going to make more and more vitamin D. It just doesn't work that way. So your skin has a built-in mechanism to actually break it down after a point as well. Yeah. So I think that taking 1,000 units of vitamin D, international units of vitamin D per day is perfectly reasonable, will help keep you out of trouble, and it's a very simple way to get your vitamin D. Well, and much safer than the sun.
Yeah, you make an important point. 1,000 units actually turns out to be 2.5 times what's in a multivitamin. Most multivitamins, if you look at your vitamin bottle, will have about 400 units. Yeah. So I think it sounds like what you're saying is you're concerned about the risks of the sun overweighing the benefits, but certainly vitamin D is something that we're going to hear more and more about. And
yeah.
again,
and you know, with vitamin D supplements, that's really to minimize disease, not to maximize health. So a minimum of 400 is perfectly reasonable, but what the studies are showing is that we really need higher units of vitamin D in order to have protective effects against cancer. So that's why I recommend 1,000. Some people go as high as 3,000, and you can still be safe at those levels. But I would start with a basic screening test to see if you're vitamin D deficient. It's an easy blood test to have while you're having your cholesterol and other tests. And then you can see if you're deficient, and then you can decide with your doctor how much you should supplement. But going to tanning salons is definitely not a good way to get vitamin D increase, because tanning salons are mostly UVA and very little UVB. So that's definitely, your viewers should know that that's really a bad way to try to get more vitamin D in your skin.
Great. No, I think that's a great wrap up. The bottom line is talk to your doc, think about getting a blood test, maybe increasing the amount of vitamin D that you get in your diet and/or supplements. Again, thank you so much for sharing all that information with us today, Dr. Day.
Thanks for having me.
We hope you found this edition of Healthy Life informative. To find out more on this story and other related health topics, we invite you to go to our website at abcnews.com. Thanks for joining us today. From all of us at Healthy Life Production Team, we wish you good health.